Welcome. My name is Peter Wayne, and I'm an associate professor at the Harvard Medical School and director of its Osher Center for Integrative Health. In my short presentation today, I'm going to be talking about Tai Chi as an exercise option for managing chronic pain. Before starting, I'm required to disclose that I oversee a community-based Tai Chi school and that my activities there do not involve any research. What I hope to do in the next few minutes is share what Tai Chi is, and especially talk about unique features of Tai Chi that I think make it a good option for people managing chronic pain conditions. Then I'll give a brief overview of the effectiveness of Tai Chi for common pain conditions based on the scientific literature, and end with a few practical tips for finding a Tai Chi program if you wish to pursue that. Tai Chi, or sometimes it's called Tai Chi Chuan, is a mind-body exercise that's rooted in a number of Asian traditions, including the martial arts, traditional Chinese medicine, and philosophy. The training of Tai Chi integrates slow, intentional movements with breathing and a number of what we call cognitive skills, including mental focus, heightened body awareness, and imagery. And the goals collectively for these elements are to strengthen, relax, and integrate the physical body and mind and improve health, personal development, and in some cases, Tai Chi is also practiced for self-defense. So what is the evidence for Tai Chi for chronic pain conditions? In the next few slides, I'm going to focus on the evidence of Tai Chi for some of the most common chronic pain conditions, and these include chronic lower back pain, chronic non-specific neck pain, and pain associated with knee osteoarthritis. And I've chosen these three because of their prevalence, but also because of their burden to individuals and medical costs to our society. So there are about 10 studies to date on the effectiveness of Tai Chi for lower back pain, the majority of those conducted in China. This is a nice study here on the slide of a study done in Australia where participants were randomized to receive Tai Chi or weightless control. And what they found was that Tai Chi resulted in about a 30% improvement with respect to pain and disability. Of relevance as well is that they studied psychological factors. And not only did Tai Chi help people with pain through physical function, but also the mental worrying and catastrophizing that Tai Chi addressed and reduced also helped explain some of the benefits to pain. So again, highlighting the benefits of the mind, body versus just the body alone. There are about 20 studies to date that have been devoted to studying the effects of Tai Chi on neck pain. In this study conducted in Germany by my colleagues and I, 114 patients were assigned to either usual care provided by their healthcare providers, Tai Chi, or neck pain exercises delivered by physical therapists. And the findings suggest that both Tai Chi and neck pain exercises resulted in a 35% reduction in pain, with no differences between the exercise groups, but both of them superior to usual care. There is also growing evidence to support that Tai Chi can be beneficial for people with knee osteoarthritis. In this study here, led by Chen Wang in the Boston area, participants were randomly assigned to Tai Chi or physical therapy specific to knee osteoarthritis. And what they found was that both interventions improved pain, overall function, and quality of life equally and significantly with big clinical benefits. Of relevance to the mind-body component of Tai Chi, only Tai Chi improved depression, which we know is comorbid with chronic pain. Physical therapy did not impact depression. So again, there may be some value added to the mind-body piece of the exercise compared to exercise alone. This slide has a couple of practical tips for finding a Tai Chi program if you're interested in it. First, of course, discuss any choices of exercise with your healthcare providers before starting. You should know that there are no national credentialing boards for Tai Chi and Qigong instructors, so you have to do a little research on your own. If you have some serious or unstable pain conditions, you might try to find programs that are associated with medical centers or find teachers who already have other health training, such as physical therapists or nurses. There are lots of programs currently being offered at YMCAs, senior centers, and independent Tai Chi schools. Things to consider when you're looking at these websites or visiting is the experience of the instructors. Longer training leads to more experience. How long the programs have been in place. You want to find a program that's been around for a couple years, not one that's just started up. You want to make sure that the place you're going to choose is accessible. If you find a great program but you're not going to be able to get there every week, that's probably not going to be something you'll stick to. And you might just talk with friends and colleagues. Word of mouth is often a great way to learn about opportunities. You're encouraged to sample a class before committing and make sure that the people who are attending it and the reasons that they're there for match your own needs. And if there are no classes available locally for you, you should search the internet because there's lots of online, virtual, or recorded programs that might be of use. Finally, if you're going to start a new program like this, you're encouraged to start it with a buddy. Sometimes it makes it more fun and it's more sustainable in the long run. In summary, Tai Chi shows promise as an exercise option for reducing pain and disability and improving function with respect to back pain, neck pain, and knee pain, but more research is obviously needed. There's no evidence that Tai Chi is superior to other forms of exercise or physical therapy in terms of pain and function, but there may be some benefits to mood or psychological well-being above and beyond what you get from physical exercise alone. It seems to be safe and adaptable across many conditions, and there are other benefits to it besides pain and mood, including balance, cognition, and cardiovascular health that can complement your goals in addressing your pain condition. Thank you for listening.